Hong Kong is becoming increasingly isolated from mainland China. The mandatory 14-day quarantine of all people arriving in Hong Kong, including its own citizens from across the border, will not begin until Saturday. That's because around 100,000 commuters cross into China each day, and they need time to prepare. The quarantine orders being invoked through rarely used special powers.
We will invoke the powers to enact legislation for people coming from the mainland, including Hong Kong residents, mainland residents and other visitors, to go into compulsory quarantine for 14 days.
As CARRIE attempts to navigate around this crisis, the cruise ship Dreamworld docked in Hong Kong harbour, with more than 3,000 passengers and crew on board. They're going nowhere, now that mainland health officials have confirmed that 3 passengers from an earlier voyage are infected with the coronavirus. Now checks are being carried out on everyone on the ship.
At the time being, I think we cannot conclude the likely time of finishing the quarantine measures right now. And I would like to reassure all the press or Hong Kong people here, our Department of Health is adopting a prudent approach in managing this incident.
Several crew members have been placed in a hospital isolation ward. The announcement by Hong Kong's leader means that all the crew and passengers aboard the Dreamworld now face the prospect of 14 days in quarantine. What's less certain, though, is the fate of the 200 passengers who left this vessel on January the 24th, before the 3 infections were confirmed. The 200 are all understood to be from Hong Kong and went ashore on January the 24th. This scare is one of the reasons why doctors and nurses have been striking. They say the only way to prevent the virus spreading is to seal the entire frontier. In another setback to the economy, Hong Kong-based Cathay Pacific Airways has asked its 27,000 staff to take 3 weeks unpaid leave before June. The airline has had to reduce flights to the mainland, its most important market. For many people here, the big concern now is a shortage of face masks. There have been long, orderly queues outside suppliers, with some waiting in line overnight in the hope of not leaving empty-handed. There seems to be no shortage of face masks or luxury on board the Dreamworld, as passengers wait to learn just how long their extended and now enforced holiday will be. Adrian Brown, Al Jazeera, Hong Kong.
Now I'm joined by Patrick Tang, Dr. Patrick Tang, who's Division Chief of Pathology Sciences at SIDRA Medicine here in Doha. Thank you so much for coming in. A lot of alarm, obviously, around the world, but how would you compare this strain of the coronavirus to, let's say, the SARS virus in 2002 or other emergencies like Ebola in Central Africa? Is it spreading more quickly? Is it more lethal than those viruses?
If we compare this novel coronavirus to SARS, we find that this new novel coronavirus is less lethal than SARS. I think the early data all shows that. One of the other things about it is that it may be just as infectious as SARS, if not more, based on some of the data that we're seeing right now. It's quite possible that the number of cases might be underestimated in China. There might be other people that they haven't been able to test for the virus. So right now, we're still in this stage where we're learning a lot more about the virus.
So is declaring it then a global emergency causing more panic than it should? I mean, was that the right move to declare it a global emergency, health emergency, you think?
I think many of us agree that this is a global health emergency. We don't need another virus in the human population, one that we don't know what will happen, one for which we don't have treatments, and one for which we don't have a vaccine.
But isn't there a risk of creating panic with that, as is the case right now, you know, with people not wanting to travel to China and so on? There is also that social risk, isn't it?
Yes, I think that's a very good statement, that we have to balance always the public health needs with the social and economic impacts of the measures that we implement for these public health emergencies.
Yeah. And so what do we know about the people who've died of this coronavirus? Are they people who had existing conditions already that were made worse by the virus? Or is it, you know, what do we know about the type of people who've died, the population?
So similar to the other severe coronaviruses, so like SARS, the people that have died are mostly older, elderly people that have had other illnesses as well, too. there have been fewer people younger who have died.
So what are the best and worst case scenarios here with this current outbreak, and how long do you expect it to last?
I think it's very hard to predict how long it's going to last. It's probably going to last a few more months at least, while we still have a hope of controlling it in China. And I think the whole world is hoping that China will be able to control it and reduce the impact they'll have on the rest of the world. I think we have to put all our efforts into containing the virus in China and helping China be able to stamp it out, just like we did with SARS. The worst case scenario would be that this virus just keeps going on, and then there's more transmission in other countries around the world. In that case, our best hope is that we can keep it under control while the efforts to develop vaccines are underway.
But it's not at a pandemic level yet, right?
It's technically not a pandemic, so a pandemic would require sustained transmission in many countries around the world. Right now, the transmissions that's occurring outside of China has been limited. It's been family clusters and smaller clusters, and all the transmission has been predictable. And every time there's been transmission, we've been able to control it. So once we are not able to control that transmission outside of China, then we have to start wondering whether this might be a pandemic.
Right, let's hope it doesn't get there. Thank you so much, Dr. Patrick Tang, for coming in and shedding some light on this for us. Dr. Patrick Tang is with the SIDRA Medicine here in Doha. Thank you very much.